Welcome to this lesson on fundamentals of nursing research and evidence-based practice, presented by Jeet Ghosh. In this course, you will explore essential principles that bridge nursing research with clinical practice. Let's dive in. By the end of this lesson, you will be able to define nursing research and its significance, understand evidence-based practice, differentiate research methodologies, grasp ethical considerations, and apply research findings in real-world settings. Mastering these concepts will empower you to make informed clinical decisions. Nursing research is a systematic inquiry aimed at improving healthcare outcomes. It identifies best practices, develops new interventions, and contributes to medical advancements. A nursing research associate plays a vital role in designing studies, collecting data, and translating findings into practice. For example, research might explore whether nurse-led interventions improve medication adherence in diabetic patients. Why is nursing research crucial? It enhances patient care by ensuring interventions are evidence-based, identifies the best treatment protocols, supports healthcare policy changes, and fosters lifelong learning. A real-world example is the implementation of early warning systems, EWS, in hospitals for sepsis detection, significantly reducing mortality rates. The roots of nursing research trace back to Florence Nightingale, who used statistical analysis to improve hospital hygiene in the 1860s. The early 20th century saw a shift toward evidence-based protocols, and by the 1950s, both qualitative and quantitative research methodologies became prominent. Today, research informs clinical trials, disease prevention, and policy development. Nightingale's work in infection control remains relevant even now. Evidence-based practice integrates research evidence, clinical expertise, and patient preferences. EBP minimizes medical errors, ensures scientific decision-making, and supports hospital policy changes. When nurses apply EBP, they improve patient safety and enhance healthcare quality. EBP follows 5 key steps. Ask, formulate a clinical question using the PICO model. Acquire, search credible databases like PubMed and Cochrane. Appraise, evaluate research for reliability. Apply, implement findings in practice. Assess, monitor patient outcomes. Following this process ensures high-quality, evidence-driven care. The PICO model structures clinical questions effectively. P stands for population, I for intervention, C for comparison, and O for outcome. For example, a research question could be, does repositioning reduce pressure ulcers in bed-bound patients compared to air mattresses? This structured approach ensures clarity and precision in research. Nursing research includes qualitative, quantitative, and mixed method approaches. Qualitative research explores subjective experiences through interviews, while quantitative research uses statistical data for objective analysis. Mixed methods combine both. Translational research focuses on applying scientific discoveries in clinical practice. Understanding these methods helps in designing effective studies. Ethical research safeguards patient rights. Key principles include informed consent, ensuring voluntary participation, confidentiality, protecting patient data, IRB approval, maintaining ethical compliance, and avoiding bias, ensuring fairness in study results. Ethical integrity is fundamental to credible research. Despite its importance, research implementation faces challenges. Time constraints, limited access to research articles, and resistance to change hinder adoption. Overcoming these barriers requires research training, free access to databases, and strong leadership support. Let's examine a case study. In 2018, research found that hourly rounding reduced patient falls in hospitals by 40%. Based on this evidence, structured rounding protocols were implemented, demonstrating how research translates into real-world patient safety improvements. To summarize, nursing research enhances patient care and safety, EBP ensures scientific decision-making, ethical research protects patient rights, and overcoming implementation barriers is crucial for integrating research into practice. Applying these principles improves healthcare outcomes. So, this is the summary of the lesson as you can see it on the screen. Now, let's reflect. What is the difference between qualitative and quantitative research? How does the PICO model guide clinical research? What are 2 ethical principles in nursing research? Discuss these with your peers. In conclusion, Mastering nursing research and evidence-based practice empowers nurses to enhance patient care and contribute to medical advancements. Understanding research methodologies, ethical considerations, and real-world applications strengthens clinical practice. Thank you for your time and dedication to improving healthcare. Thank you. Learning is a continuous process, so let's move on to next lesson to continue learning and get certified.